self-medicating substance abuse, which makes it a bit tricky. If a person's abusing any kind of substances, then the rule of thumb is you don't do trauma therapy if abuse is continuing. That includes substances as well. So
I would imagine you need a clear head to be able to do that, as you said.
Exactly. You really need to be at your peak to do this.
And this is just fascinating, Glenn, and that this it's one thing to have something that is an anecdotal kind of treatment. Maybe somebody said that it worked and we should give this a try. But this has been studied.
Absolutely. Absolutely.
And in fact, I had looked at a recent study that showed clearly that EMDR is superior to business as usual psychotherapy for specific post-traumatic stress disorder patients. Exactly.
And we have a greater understanding now of why that is. That again, if you take the two-brain approach, that there's our cerebral cortex where our antenna, the part of our brain that does our thinking, our talking, and our planning, and our problem solving. And then there's other part of our brain, our limbic brain, that does the emotional stuff, the part of our brain where we store trauma. One of the things that trauma brain doesn't have is language. It's called the silent horror for a good reason, that a person becomes neurologically incapable of articulate speech when they're triggered. Mm-hmm. And so we've been approaching this historically with talk therapy. So you see the problem there, that talk therapy, all it does is either gives this what we call the narrative approach to the trauma, just the surface of it, or it actually triggers the actual trauma and makes things actually worse for them.
Wow. Could that be the reason why the thinking these days with debriefing a horrible event is that you don't have the person who is just the victim of this trauma spell out everything that they had experienced to articulate what just happened. You need to get this out of you. That was the old way of thinking. Isn't it true that there's really a new way of thinking?
Exactly. And this is where we also draw the line between PTSD, which is more of a long, the PTSD is what happens when we don't recover properly from a trauma. If you get to somebody immediately after a trauma, we do what we call EMDR, or EMD rather, which is we help them process the immediate event instantly on the spot. There's no reprocessing to be done because it hasn't been processed in any way at all. It hasn't been stored limbically. Mm-hmm. And so we get to go straight to the narrative part. We get them to talk about what happened. As long as we get it soon enough, then we can prevent PTSD from happening.
I see. Wow. So, Glenn, is EMDR useful for, say, veterans?
Absolutely. In fact, the very nature of the way veterans and soldiers are trained, that lends itself very well to EMDR as a treatment, because EMDR, as I mentioned, it starts with resource building. It starts by understanding what a person's strengths are and building on them and helping them develop those strengths and skills and ability to self-soothe and ground. Veterans are trained in resiliency. They're trained in problem solving. Now, typically, clinicians are pathologically based. We approach problems by asking our clients what isn't working. That doesn't work well with veterans because they are focused on what does work, and that's how they're trained. And so when you start working with a veteran and ask them to understand and identify and work on what is working, understand their strengths, that goes over very well. So it does work very well with veterans.
Well, Glenn, I would love to talk about this all day with you, and it was just a pleasure to have you here today. I am so lucky to have you as the latest addition to Casco Bay Medical.
Thank you very much.
And I'm just very glad that you're providing the service.
Thank you very much. I appreciate it.
Thank you, Glenn. This has been Optimal Living with Dr. Jeremy Spiegel. My guest today, Glenn Selwood, a psychotherapist and practitioner of eye movement desensitization and reprocessing for post-traumatic stress disorder. Optimal Living is sponsored by Casco Bay Medical, New England's most thoughtful practice, located in Greater Boston, Massachusetts, and in the heart of Portland, Maine's historic Old Port District. Thank you.